This is the Patient Assessment Skills video for the UCLA Center for Prehospital Care. This video will focus on the medical assessment of the patient. When entering the scene, the EMT will ensure their person, partner, and patient are safe. I'm scanning the environment, looking out for any scene hazards. I see one patient at this time who appears to be suffering from a medical illness, so this will be a nature of illness call. I recognize the need for additional resources. Here is where I call advanced life support. The patient appears to be suffering from a medical illness, so spinal motion restriction is not needed at this time. My patient is a female, appears to be in her 50s, seated in a chair in a tripod position, breathing with accessory muscle use. Hi, my name's Lissa. I'm your EMT. Can you tell me your name?
Yes, Teresa.
Hi, Teresa. Can you tell me where we are right now?
My office.
Okay. Can you tell me about what time of day it is today?
Late afternoon.
Okay. And can you tell me briefly what happened?
Yeah, I was carrying a stack of papers to my office and just found myself real short of breath.
My patient is alert and oriented ×4. She's clearly short of breath, so my partner and I will apply a nasal cannula at 4 liters per minute. Take a deep breath in through your nose and slowly out through your mouth. Good. That's very good. My patient's chief complaint is shortness of breath. My patient is speaking to me, so I know her airway is open and patent. Her breathing rate is at 24, irregular, and rapid with accessory muscle use. Check your lungs, take a deep breath in. Exhale. Come under your arm. Take a deep breath in. Exhale. Good. Come on this side. Okay, take a deep breath in. Good. Come under your arm. I hear wheezing in all fields. My patient's pulse are rapid, regular, and strong at 110 beats per minute. My patient's skin signs are pink, cool, and clammy. Since the patient is having shortness of breath, we will want to initiate transport to the hospital. Ma'am, because of your shortness of breath, I have a couple questions I'd like to ask you and then initiate taking you to the hospital for further evaluation, okay?
Okay.
My partner will be gathering Teresa's vitals while I perform the secondary assessment. Teresa, I noticed that you're leaning over, breathing heavily. Do you have any allergies?
No, not that I'm aware of.
Do you currently take any medications?
Yes, I have an inhaler for my asthma.
Do you have that inhaler with you?
I do.
And did you use your inhaler today?
No, I didn't.
Do you see a doctor for anything else other than your asthma?
No, just my asthma.
Okay, and did you have anything to eat or drink today?
Yeah, I had steak, baked potato, green beans, iced tea.
Okay. And what happened when you called 911 today?
After my lunch, I went out and smoked a cigarette.
Okay.
And went back in, grabbed my documents, went to my office, and just found myself so short of breath, very lightheaded.
Okay, did that happen all of a sudden or was it gradual?
All of a sudden.
And is there anything that makes the breathing worse?
Probably standing up and walking around.
Okay. Is there anything that makes the short of breath better?
Sitting and definitely the oxygen.
Okay, and can you describe to me what it feels like?
Feels like I can't get any air in my lungs.
Okay, and if shortness of breath, if normal was 0 and 10 was the worst shortness of breath you've ever had, what would you currently rate this at?
Maybe a 6.
Okay, and about how long ago did this happen?
Maybe about 20 minutes ago.
Okay. Partner, what are our set of vitals?
Pulse is 110 beats per minute. Respirations are 24. Blood pressure 140/98. Pupils are equal, round, and reactive to light. Lung sounds have bilateral wheezing. Level of consciousness is AO ×4. Pulse ox is 98%. Blood sugar is 115. Skin signs are pink, cool, and clammy. Glasgow Coma Scale 15.
Because my patient has a life threat, I want to initiate transport to the hospital. This is a load and go patient.